Most doctors will never tell you this, but aging isn't happening because your body is wearing out. That's a lie. After 24 years as a surgeon, standing in operating rooms with patients who did everything right, good lab numbers, clean scans, healthy diets, I watched their bodies age faster than they should have. And it made no sense until I discovered what's really happening inside your cells right now. Something so simple, so overlooked, that once you understand it, everything about aging changes. I'm Dr. Megan Foster, and what I'm about to share with you will completely reframe how you think about getting older. Now, before we dive deep, I need to be transparent with you. I spent over 2 decades treating cardiovascular disease, neurodegeneration, metabolic decline. I saw patterns that traditional medicine couldn't explain. That's why I created something outside the hospital system. It's called the Longevity Foundation Guide. It's not a diet plan. It's not a supplement list. It's a complete breakdown of what actually drives aging after 55 and why good numbers on paper don't always translate to long-term health. I'm sharing it with you at a fraction of what repeated specialist visits would cost, and you'll find the link in the description and the pinned comment below. But right now, let me show you exactly why this matters. Here's what shocked me during my surgical career. I'd have two patients, same age, similar genetics, similar lifestyles, nearly identical lab work. One would decline rapidly, brain fog, joint pain, skin aging, low energy. The other would stay sharp, mobile, resilient, energetic. And I kept asking myself, what's the difference? It wasn't discipline. It wasn't luck. It wasn't genetics. It was something happening at the cellular level that nobody was measuring. And when I finally understood it, everything clicked into place. The difference was cellular congestion. Let me explain what I mean by that. Your body is made up of trillions of cells. Every single one is working constantly, building proteins, generating energy, repairing damage. Now, just like any system that's working hard, this creates waste. Damaged proteins that can't function anymore, broken cellular parts, metabolic byproducts. And here's the thing most people miss. If that waste doesn't get cleared out, it starts to build up. The system gets congested. Everything slows down. And that's when aging accelerates. Not simply because you're getting older, but because your cells can't function efficiently anymore when they're surrounded by all this accumulated debris. Here's a way to understand this. We've all experienced what happens when we get too busy and things start piling up around us. We stop putting things away. We ignore little problems. Before long, we're moving slower, feeling overwhelmed, unable to function at our best. Our cells experience something remarkably similar. When they can't clear out damaged components, everything becomes sluggish. Energy production drops, repair mechanisms slow down. And here's the part that changes everything. Your body actually has a built-in cleanup system designed to handle this. It's called autophagy. By the end of this video, you're going to understand three critical things. First, why some people age faster despite doing all the right things on paper. Second, what autophagy actually does inside your cells and why it's the most important anti-aging process nobody talks about. And third, how to activate it naturally without extreme fasting, without starvation, without disrupting your life. This isn't theory. This is practical biology that works with your body, not against it. Now, let me give you some context about where this understanding comes from. I didn't learn this in medical school. I learned it by watching patients decline when everything suggested they should be thriving. I learned it by diving into research that mainstream medicine ignores. I learned it by asking uncomfortable questions about why our approach to aging is fundamentally broken. This is education, not medical advice. But I can tell you with absolute certainty that most people are aging faster than they need to, not because they're doing something wrong, but because nobody explained the real mechanism. So let's talk about what autophagy really is. The word literally means self-eating. And I know that sounds strange, but stay with me because this is where it gets fascinating. Autophagy is your body's internal recycling system. It's how your cells break down damaged components, remove dysfunctional parts, and recycle the raw materials to build new healthy structures. When autophagy is working well, your cells stay efficient. Inflammation stays lower, repair happens faster. Your brain clears out damaged proteins that would otherwise accumulate and cause neurodegeneration. Your skin repairs itself more effectively. Your muscles maintain function. your organs stay resilient. But when autophagy slows down, and this is critical, cellular trash piles up. Inflammation rises, energy production drops, repair slows, tissues lose their resilience, and aging accelerates. This isn't cosmetic. This isn't superficial. This is foundational biology. And here's what most people completely miss. The reason autophagy slows down isn't because you're getting older. It's because of how we eat in modern society. Let me explain the real villain here. Your body has two main modes. One is growth mode, where you're building and repairing tissues. The other is cleanup mode, where you're clearing out damaged components. Here's the catch. You can't do both at the same time. It's physiologically impossible. Every time you eat, especially refined carbohydrates, frequent snacks, sugar-laden foods, you activate something called mTOR. This is a pathway that signals your cells to grow, build, divide. Now that sounds beneficial, right? Growth sounds positive, but here's the problem. When this growth signal is active, the cleanup process shuts off completely. No clearing, no recycling, just ongoing accumulation of cellular waste. And in modern eating patterns, this growth signal stays active almost all day, every day. Think about how most people eat today. They wake up and have breakfast, maybe around 7. A couple hours later, they're having a mid-morning snack. Then lunch comes. Mid-afternoon, there's coffee with something sweet. Dinner in the evening, and then another snack before bed. What I'm describing isn't unusual. This is the standard eating pattern for millions of people. And here's what's happening inside their bodies. Every single one of those eating occasions, even the small ones, triggers that growth signal I just mentioned. Their cells never get a break. There's no window of time where the cleanup process can actually engage. And without that downtime, cellular waste just keeps building up. This is one of the biggest hidden drivers of accelerated aging, and almost nobody is talking about it. Not your doctor, not mainstream health advice, nobody. Because it doesn't fit the narrative that eating constantly keeps your metabolism high. That narrative is outdated and incomplete. Now, I want to pause here because I know what some of you are thinking. You're thinking, okay, so I need to fast for days to activate autophagy. And that's where most information gets dangerous. You don't need extremes. You don't need prolonged fasting. You don't need to starve yourself. Autophagy turns on when the body senses low but safe energy availability. That doesn't mean no energy. It means periods without constant fuel. It means stable blood sugar. It means reduced insulin signaling. And here's what's interesting. Populations with the longest health spans, places like Okinawa, Sardinia, Icaria, they naturally spend parts of the day in a fasted state without even thinking about it. Not because they're trying to be healthy, just because their eating patterns naturally allow for cleanup time. So, what does this look like practically? Let's get specific, because this is where it becomes real. Say you normally eat breakfast around 7 in the morning. What if you simply delayed that first meal until 10? You've just given your body 3 additional hours where cellular cleanup can continue. If you stop snacking between meals, you're creating these windows throughout the day where autophagy can activate. And if you finish dinner by 7 in the evening and don't eat again until the next morning, you've created what's called a fasting window, 12 to 14 hours where your body can focus entirely on cleanup. That's enough to start activating this process. You don't need to fast for an entire day. You don't need to skip meals completely. You just need to stop the constant feeding cycle. But here's where it gets even more interesting. The benefits of autophagy go far beyond what most people realize. When autophagy improves, your skin repairs more efficiently. You're not just slowing down visible aging, you're actually supporting the cellular mechanisms that keep skin elastic, hydrated, and resilient. Your brain cells clear out damaged proteins. This is huge. The accumulation of damaged proteins in the brain is directly linked to Alzheimer's, Parkinson's, and cognitive decline. Autophagy is your brain's natural defense system against neurodegeneration. Your muscles maintain function longer. As we age, muscle loss is one of the biggest predictors of mortality. But it's not just about building muscle. It's about maintaining the quality of muscle tissue. Autophagy clears out damaged mitochondria, the energy factories inside muscle cells, and allows new, healthy mitochondria to function properly. Your organs stay more resilient. Your heart, your liver, your kidneys, every organ depends on cellular cleanup to function optimally. When autophagy declines, organ function declines. When autophagy improves, organ function improves. And here's something that really surprised me when I started researching this. Autophagy support often improves how people feel before any lab marker changes. People report better energy, clearer thinking, improved mood, reduced joint pain, better sleep. And this happens within weeks, sometimes even days, of changing their eating patterns. Why? Because when you stop constantly fueling growth and allow cleanup to happen, inflammation drops. And inflammation is at the root of almost every symptom people associate with aging. Now, if you're finding this valuable, do me a favor. Hit the subscribe button right now. I'm sharing information that most doctors won't tell you, not because they're hiding it, but because they don't know it. And drop a comment below telling me what surprised you most so far. I read every single comment, and I use your feedback to create content that actually helps you. All right, let's keep going, because there's something critical I need to explain about why this process shuts down in the first place. The modern diet is designed to keep you in constant build mode. And I'm not talking about junk food. I'm talking about foods that are marketed as healthy: whole grain cereals, low fat yogurt with fruit, granola bars, smoothies, fruit juices. These foods spike insulin. And insulin is the signal that tells your body, we have abundant energy. Stop cleaning, start building. Even if those foods are technically nutritious, if they're constantly spiking insulin, they're constantly blocking autophagy. And here's the part that frustrates me. The advice we've been given for decades is to eat small, frequent meals to keep your metabolism high. Eat every 3 hours, never skip breakfast, always have a snack. That advice is fundamentally flawed when it comes to longevity. Yes, eating frequently might keep your metabolism active in the short term, but it also keeps mTOR active. It keeps autophagy suppressed. It accelerates cellular aging. And decades later, people wonder why they're declining, despite doing everything their doctor told them to do. So let me give you a framework that actually works. The first thing to understand is this isn't about eating less, it's about consolidating when you eat into a shorter window of time. Most people do really well with a 12 to 14-hour fasting window. If you finish dinner by 7 p.m. and don't eat again until 7 to 9 a.m. the next morning, you're there. That's it. No extreme fasting, no skipping meals, just creating boundaries around when you eat. The second piece is eliminating snacking, and this is huge. Every time you snack, even something small, you're triggering an insulin response. You're shutting down autophagy. You're interrupting the cleanup process. When you eat 3 meals a day with nothing in between, you're giving your body multiple opportunities throughout the day to activate cellular cleanup. The third thing is what you actually eat at those meals. Focus on protein and healthy fats. These foods provide real satiety without triggering dramatic insulin spikes. I'm talking about eggs, fish, meat, avocado, nuts, olive oil. These keep you full, support muscle maintenance, and don't constantly activate that growth signal the way refined carbohydrates do. I'm not saying you can never eat carbohydrates. I'm saying be intentional about when and how much. The fourth element is movement. Exercise is one of the most powerful autophagy activators we have. When you exercise, especially with some intensity, you create cellular stress. That stress signals your body that cleanup is needed. You don't need to run marathons. You don't need hours in the gym. But you do need consistent movement that genuinely challenges your muscles and cardiovascular system. And the fifth foundation is sleep. This is when your body does its deepest cellular repair. When you're sleep deprived, autophagy gets suppressed, inflammation rises, cellular damage accumulates. If you're only sleeping 5 or 6 hours a night, you're simply not giving your body enough time to complete the cleanup process. Aim for 7 to 9 hours of quality sleep. This isn't optional, this is foundational. Now let me address supplements. People constantly ask about pills that claim to activate autophagy. There are compounds shown to influence autophagy in research: resveratrol, spermidine, berberine, curcumin. But research dosages are often far higher than supplement amounts. Bioavailability is questionable, and critically, no supplement overcomes constant eating and poor sleep. Fix the fundamentals first, then consider targeted supplementation if you want to optimize further. But there's one compound worth mentioning: black coffee. Coffee consumed without sugar or cream is a potent autophagy activator. The polyphenols trigger cellular cleanup pathways. This is why coffee consumption consistently links to longevity in population studies. So, if you're drinking black coffee during your fasting window, you're enhancing the process. Here's where most people make a critical mistake. They implement everything overnight. 6 meals to 1 meal a day. Cut all carbohydrates. Intense exercise, they burn out within a week. That's not sustainable. Start with one habit. Push breakfast back 2 hours. Do that for 2 weeks. Let your body adjust. Then add the next habit. Stop snacking between lunch and dinner, another 2 weeks. This is how you build a lifestyle that lasts. And here's what happens when you do this consistently. Within the first week, improved energy. Not because you're eating more, but because cells finally get cleanup time and function efficiently. Within the first month, clearer thinking. Brain fog lifts because your brain clears cellular waste that accumulated for years. Within 3 months, better stress response, faster recovery, more resilience as cells repair properly. Within 6 months to a year, visible changes others notice. Your skin, energy, entire presence shifts. You're not masking symptoms with supplements or medications. You're supporting the fundamental process that keeps you young at the cellular level. This is real anti-aging, not expensive creams or hormone replacement or biohacking gadgets, just basic biology working properly. Now, I want to talk about something rarely discussed but critical. Autophagy isn't just about individual health, it's about quality of life in later years. Think about people aging well, sharp, mobile, independent, engaged. Now think about those declining, foggy, frail, dependent on others. The difference isn't genetics, it's cellular health determined by how well your body cleans itself. This is why I created the Longevity Foundation Guide. I kept seeing patients in their 60s and 70s declining rapidly when it didn't have to be that way. They needed information nobody was giving them about circulation, inflammation, recovery, how the body maintains itself over decades. I put it all together in one resource. No fluff, just clear explanations of what drives aging and what you can do about it. If you're serious about understanding your body and controlling how you age, the link is in the description. Let me tell you about something that happened in my practice that really drove this home. I had a patient, 72 years old, came to me with cardiovascular concerns. His labs were decent. His weight was normal. But he looked and felt much older than his age. Fatigue, joint pain, brain fog, skin aging, all the classic signs of accelerated aging. And when I dug into his routine, here's what I found. He was eating 6 times a day. Breakfast, snack, lunch, snack, dinner, snack. All healthy foods, whole grains, fruits, lean proteins. But constant eating. His body never had a chance to activate autophagy. I explained the concept of cellular cleanup. I explained meal timing. I explained why constant eating, even healthy eating, blocks autophagy. And I gave him one simple change. Stop snacking. Eat 3 meals a day with no food in between. That's it. No extreme fasting, no dietary restriction. Just stop eating all day long. 6 months later, he came back for a follow-up, and I almost didn't recognize him. His energy had completely transformed. His brain fog was gone. His joint pain was significantly reduced. His skin looked different, and his labs had improved across the board. Same person, same genetics, different internal environment. Because he finally gave his cells the downtime they needed to clean up and repair. That's the power of understanding how your body works. And that's what frustrates me about mainstream advice. We focus on calories, macros, exercise minutes, step counts. All valuable, but none address the fundamental question. Can your cells clean themselves? If not, everything else is secondary. Perfect macros mean nothing if autophagy is suppressed. 10,000 steps won't prevent cellular damage if you're eating constantly. Now let me talk about one habit that blocks autophagy even in people doing everything right. Artificial sweeteners. Diet sodas, sugar-free gum, zero-calorie energy drinks. People consume these thinking they avoid sugar and insulin spikes. But research shows artificial sweeteners still trigger insulin responses in many people. Not as dramatic as sugar, but enough to suppress autophagy. They also disrupt gut microbiome, crucial for cellular health and inflammation. So if you're intermittent fasting but drinking diet soda all day, you're undermining the process. During your fasting window, let me tell you what you can have without interrupting the cellular cleanup process. Water, of course. Black coffee, which actually enhances autophagy. Plain tea of any kind, whether that's green tea, herbal tea, or black tea. Mineral water. That's the list. Notice what's not on there. No cream in your coffee, No sweeteners, whether artificial or natural. No lemon water. No bone broth. Nothing that contains calories or triggers a sweet taste response. The goal here isn't just avoiding calories. It's keeping insulin low so that cleanup process stays active. Even seemingly tiny amounts of certain substances can interfere with that. Now, I know some of you are thinking this sounds too simple. And here's the truth: simple doesn't mean easy. Changing eating patterns in a culture promoting constant eating is challenging. Going against decades of small, frequent meal advice is challenging. Sitting with hunger while your body adjusts is challenging. But simple and challenging beats complex and impossible. That's what most health advice has become: so extreme and disconnected from real life that nobody sustains it. This approach works because it's rooted in basic biology. Your body wants to clean itself. It's designed to activate autophagy and repair cellular damage. It's designed to stay healthy and resilient for decades. But you must give it the conditions it needs. Stop interrupting the process with constant food. Stop spiking insulin all day. Stop keeping your body in constant build mode. When you do, everything changes. Not overnight, but consistently, progressively, undeniably. Let me walk you through what this actually looks like in real life. You wake up around 6 in the morning. Instead of immediately heading to the kitchen for breakfast, you drink some water. If you want coffee, have it black. Then you go about your morning: work, movement, thinking. During this time, your body is in that fasted state where cellular cleanup is actively happening. Around 10 a.m., you have your first meal, maybe eggs with avocado and some vegetables, perhaps some berries on the side. The combination of protein, healthy fats, and fiber provides nutrients and keeps you satisfied without triggering a dramatic insulin response. You feel full for hours. Come 2 in the afternoon, you eat again. Perhaps salmon with leafy greens, olive oil, maybe a sweet potato. Again, nutrient dense, satisfying, blood sugar remains stable. Notice what's not happening here. There's no snacking between these meals. Your body has had 4 solid hours to continue cellular processes without new fuel constantly coming in. Then, around 6 or 7 p.m., you have your third meal. Maybe grass-fed beef with broccoli, a small salad, perhaps some dark chocolate for dessert. And then you're done eating for the day. No evening snack, no late-night ice cream, nothing until the next morning. Your body now has 12 to 16 hours overnight where deep autophagy can activate while you sleep. Now compare that to the typical pattern: breakfast early, mid-morning snack, lunch, afternoon snack, dinner, evening snack. 6 times food enters the body across 14 hours. Each triggers that growth signal, preventing cellular cleanup from ever engaging. Then people wonder why they're aging faster, feeling tired and foggy despite eating healthy foods. Now let's talk about what happens when you get this wrong. When autophagy is chronically suppressed, damaged proteins accumulate in your brain, directly linked to Alzheimer's and dementia. Damaged mitochondria pile up in your muscles, leading to weakness and frailty. Your skin ages faster with wrinkles and lost elasticity. Your blood vessels accumulate damage, increasing cardiovascular disease risk. Throughout your body, damaged cells increase cancer risk. This isn't theoretical. This is established science. And here's what makes this tragic: most of this is preventable with basic lifestyle changes that support your body's natural cleanup mechanisms. The information exists, the research is clear, but it's not reaching people. That's why I created the Longevity Foundation Guide, because you deserve to understand what's driving your symptoms and have tools that address root causes, not just manage symptoms. Now, I want to address something important. This is education, not medical advice. I'm not your doctor. If you have diabetes, medications, or chronic health conditions, consult your healthcare provider before making dietary changes. But the principles are universal. Autophagy and cellular cleanup matter for everyone. Giving your body downtime from constant eating matters for everyone. Let me tell you what happens when people start implementing this. The first few days are the hardest. You're used to eating constantly. You might feel hungry or irritable. That's normal. But by day 3 or 4, the hunger diminishes. Your body accesses stored energy more efficiently. Your blood sugar stabilizes. Your energy becomes consistent instead of the peaks and crashes from constant eating. By week 2, mental clarity improves. Less brain fog, better focus. This is autophagy cleaning up cellular waste. By week 4, physical changes appear: less joint pain, better digestion, improved sleep, more resilience. By month 3, the changes become obvious to others. Your skin, your energy, your presence, all different. Because you're supporting fundamental cellular health, not just masking symptoms. And here's what I love about this approach: it gets easier with time, not harder. Once your body adjusts, it becomes natural. Food cravings diminish, the blood sugar roller coaster stops, your body efficiently accesses stored energy, hormones regulate properly, and benefits compound over decades. This is a fundamental shift in how you live, not a quick fix. Now, before we wrap up, one final framework. Aging is not your body falling apart or inevitable decline. It's your body struggling to keep up with cleanup when you never give it the conditions it needs. When you understand that, everything changes. Fear and helplessness disappear. You realize you have control. You can't stop time or change genetics, but you can change your internal environment. You can give your cells downtime. You can support cleanup. You can age slowly instead of rapidly. So here's what I want you to do. Pick one change. Push breakfast back 2 hours. Eliminate one snack, or finish dinner earlier. Do it consistently for 2 weeks. Don't overhaul everything overnight. Then pay attention to your energy, mental clarity, mood, and sleep. Your body responds quickly when you give it what it needs. If this video has been valuable, if you're starting to understand aging differently, do 2 things for me. First, subscribe to this channel. I'm putting out content that goes deeper than surface level health advice. Content that explains how your body actually works. Content that gives you tools you can use immediately. And second, leave a comment telling me what you're going to implement first. Are you going to push back breakfast? Are you going to eliminate snacking? Are you going to focus on meal timing? Let me know in the comments. I read every single one and I use your feedback to create better content. And if you want to go deeper, if you want to understand not just autophagy, but the complete picture of what drives aging after 55, circulation, inflammation, metabolic health, hormonal changes, cellular repair, all of it explained clearly without medical jargon, check out the Longevity Foundation Guide. The link is in the description below. Think of it as the foundation most people were never given, the information that makes everything else make sense. It's a fraction of the cost of repeated doctor visits, and it gives you knowledge you'll use for the rest of your life. In the next video, I'm going to explain the one habit that quietly shuts down autophagy even in people who think they're doing everything right. That video is coming soon, so make sure you're subscribed so you don't miss it. Remember, aging is congestion, not wear and tear. When you support cellular cleanup and give your cells downtime, repair becomes possible again. Different internal environment, different trajectory. This is real anti-aging through basic biology. It's available right now with one simple change. Start today. Your future self will thank you. I'll see you in the next video.